Welcome. I'm Leslie Canham.
I'm Mary Gavoni.
I'm Linda Harvey.
I'm Olivia Wan, and together we are the Compliance Divas.
Welcome to this special edition of the Compliance Divas podcast on California's mandatory COVID vaccination order. We bring clarity and simplicity to compliance by navigating regulatory compliance to keep you on course. We invite you to subscribe to the Compliance Divas podcast through your favorite podcast channel or on our website at thecompliancedivas.com. Any of the resources that we mentioned during our podcast can also be found on our website, thecompliancedivas.com. And we invite you to submit any questions to support@thecompliancedivas.com. Hello, my name is Linda Harvey, and I'm serving as your moderator for this special edition. The information in this podcast that we're discussing today is current as of August 7th, 2021. So listeners, just when we thought our professional lives were going to level out and we could get into some rhythm of our new normalcy, the Delta variant of the SARS-CoV-2 is spreading like wildfire. And as a result, many municipalities and states and even private organizations and businesses are reinstating requirements for the vaccinated as well as unvaccinated individuals, along with additional other measures. One of these additional measures is mandatory vaccinations. For example, hospitals around the country are carefully weighing the pros and cons of requiring the COVID vaccine as a condition of employment. You may have seen the news story where Houston Methodist was the nation's first hospital system to require its credentialed healthcare providers to get the shot. And they're mandating the vaccine for nurse practitioners, physician assistants, student scientists, anybody that has clinical privileges at their hospital. So today we're going to focus exclusively on California's mandatory COVID vaccination order and what this means for California dentists and their team. And as the Divas discuss different aspects of these mandates, we'll first turn to our resident California expert, Leslie Canham. Leslie, please help us. What exactly do these mandates mean for our California listeners?
Well, Linda, first of all, this is the first in the nation vaccination requirement for healthcare workers that spans an entire state. And the governor made an announcement last week. The public health officer issued an order, and the order said that it requires all healthcare workers in the state to either show proof of full vaccination of COVID-19 or be tested regularly. And fortunately, the public health order gave us a list of the healthcare settings that this order applies to. Now, this also applies to some state employees, and there's some cities and counties that are going to extend this order to their own employees. But in the healthcare setting, the order applies to acute healthcare and long-term care settings, high-risk congregate settings, and then they made a list of other healthcare settings. On that list is dental offices. So we have clear and concise guidance that we are subject to this mandatory get vaccinated or get COVID testing weekly. Now, most of the order is clear, but there's still a few areas that are unclear and require some clarity. I'm paying close attention and staying connected to the California Dental Association as they work with not only the public health department, but with the state legislators and the labor commissioner to find out more details. I'm getting inundated with questions about who pays for the testing, and would it be a burden placed on the employee? Would it be a burden placed on the employer? What about the time that it takes to get the testing, and how are those test results maintained? So at this moment in time, we know that the order covers dental offices. What we don't know specifically is, again, the cost, who's going to bear the cost of the testing, and how exactly tracking will take place. Another question that has come up over and over since this order was released was, well, how's this going to be enforced? And it's something that is not necessarily a dental board enforcement issue. At this point, I don't know if OSHA will become engaged with it, but I do know that the public health officer can enforce and can actually penalize a dental practice for not complying with the public health order. So the other confusing part about the public health order is that on August 5th, there was another order, actually two orders that were issued by the public health department. And a lot of dental practices thought that the new order supersedes the old one, but it doesn't. The new order does not apply to dental offices, and it requires that healthcare workers get vaccinated and do not have the option of getting weekly tests if they choose not to vaccinate. And of course, we know that unvaccinated exemptions, anyone that is going to hold an exemption or put forward an exemption, the public health department is saying, if it is for a medical purpose, then you need to have a note from a physician to provide you with actual proof that you have a medical condition. And the other is a sincerely held religious beliefs. So that's something I think people are wondering, well, what about my own personal beliefs? What about my constitutional rights? And know that neither of those are listed in the public health order. So the question now is, going forward, when do we have to be in compliance with this regulation? Starting on Monday, August 9th, and all healthcare workers in dental practices need to be fully vaccinated or have at least had the first part of their vaccination implemented by August 23rd. Not a lot of time, especially since one dose of the Johnson & Johnson vaccine is all you need, but then getting scheduled for that and getting that done, whereas the Moderna and Pfizer have a waiting time of, I believe it's 4 to 6 weeks, if I'm not mistaken, between the first dose and the second one. So people need to pay attention to this now. And one of my concerns, along with the California Dental Association, is the impact on the workforce in California. Is this going to drive dental workers out of dentistry? And we're already suffering from a shortage. We have not only with the stay-at-home orders where many dental workers had to stay home with kids that were in school. Now that kids are going back to in-person classes again, they may be able to return to the workplace, or they may still not feel safe returning their children back to in-person training. So that would possibly impact the workforce. And then how this is going to be impacted if a dentist follows the public health orders and an employee decides that this their objection to vaccination is stronger than their need to stay employed. So that's where we are with the information. And again, to remind everyone, the January 26th public health order, which will be posted on our Compliance Divas website as a resource for you, is in effect for all dental practices. The two new orders that were issued on August 5th by the Public Health Department do not apply to dentistry. That's where they've taken the choice of getting tested weekly if you choose not to become vaccinated. They've taken that choice out of the hands of certain workers. And it order applies to acute care hospitals and skilled nursing facilities and immediate care facilities. And they also have listed other types of healthcare providers, but dentistry is not listed on that. There's one other part. It was actually two orders that were issued. One regarding taking away the right to be tested instead of vaccinated. And the other is also initiating and implementing a testing program or vaccination passport, if you will, for visitors to people who are patients in these healthcare facilities. So that's another order. Again, it doesn't require us to have a vaccination passport for our patients to come to our dental practices. We can ignore the August 5th public health orders, both of them, but we must adhere to the January 26th public health order.
Thank you, Leslie. That is so much information. So let's take a moment and just recap it briefly. So it's the July 26, 2021 order that all California healthcare professionals, including dental teams, need to comply with. And the latest order on August the 5th, they do not. So in other words, while the vaccine is mandatory, if someone is not going to take the vaccine, then they have to be tested weekly. And from what I understand that you said, that's the part that's still in transition, even though the deadline, the first deadline is 2 days from the recording of this podcast, August the 9th. there's still, the doctors need to be prepared, need to be watching CDC, need to stick with you closely and learn how this unfolds and what the next steps are, because it may not be exactly business as usual on Monday, August the 9th. And for sure, between now and August 23rd, the practice needs to find some time to learn about all these changes and get organized and get them implemented. Did I miss anything else urgent in that, Leslie?
You got that 100% spot on.
Oh, well, thank you. So thank you. So Olivia, then let's take a moment and turn to some of the HR risks for the doctors in California. And what do you envision there with, vaccination and firing people, and is it going to be a condition of employment? What can you see or know about this?
Well, with this new state order in California, obviously weekly testing of non-vaccinated employees can be burdensome. And so it may be the position of the employer that they wish to make their vaccine program mandatory. But before a dental practice does that in California, we do suggest that they take into consideration the following issues. One is the vaccine is in its emergency use. So what are the potential vaccine complications or side effects? Are there any reasonable accommodations that could be made for employees who decline the vaccine for medical reasons, such as a pregnancy? And how will you deal with sincerely held religious objections? Whether they can be accommodated or not. Can you meet the burden of that it's causing an undue burden on your practice? And also think about the exposure of legal risks, such as discrimination claims, and whether or not there would be disparities on how you treat vaccinated people versus non-vaccinated people. So for example, with a mandatory vaccine program, that means that you would dismiss people if they're not vaccinated. And if you're having to dismiss an employee because they're not vaccinated, and another person is not vaccinated either, but you rely on that person so much and you choose not to terminate the other one's employment, then that is going to show a disparity on how you're treating employees. And so we want to be mindful of the Equal Employment Opportunity Commission, the EEOC, to be sure that we are in compliance. And what we are suggesting is that if you wish to make a mandatory program in California, please consult an attorney that is familiar with employment laws in your state to make sure that you are in compliance and you avoid any problem. Now, it is certainly within the employer's right to ask for documentation of the COVID-19 card. So if you've been vaccinated, provide a card, and it must be stored confidentially in their employee medical record. That should not be within sight of other individuals. And we realize that people could lie about their status. There's been discussion of people lying, telling patients they were vaccinated and they weren't. So we do need documentation, and hopefully we can get through this period as painlessly as possible. But my suggestion is to make sure you talk to legal counsel to stay within the parameters of the law.
Thank you, Olivia. There are so many considerations for our doctors in California. It's not, as you said, it's not just, this is my practice, I want to do it my way, or I want to keep this team member, but this person I've been wanting to dismiss from my practice anyway. This is not a chance to leverage this for the benefit of someone's personal gains or changes in a practice. It has to be done very carefully when it comes to managing the HR issues related to this. Leslie, did you have any additional thoughts or questions too, as well as dental workers getting vaccinated or not vaccinated?
Yes, Linda, we keep hearing over and over again that we have our clients and audiences are facing employees who are not willing to get vaccinated for whatever reason. And in California, it is a public health order. So what do we do if an employee refuses to get vaccinated? And, we don't really want to terminate a good person. Olivia went through all of the reasons to consider consulting an attorney before we make any rash decisions. But how do we convey to our employees that this is a public health order? What are the consequences of not getting vaccinated? Well, if that employee is going to have contact with other employees or with the patients, then they pose a public health risk or threat. and the dentist employer themselves would be the ones that would be held accountable. When we first had our reopening from being locked down in dentistry, our state had issued information that we would follow public health officers' orders for our local area. I believe that was a CDC recommendation as well. And the public health orders required social distancing and required us to put up public notification, public service announcements to our patients about hand hygiene and cough etiquette and social distancing. And when I would visit dental practices that were starting to reopen, I reminded them when they would gather in their reception room, close together, sometimes unmasked and without any public service information, that if the public health officer drove by our practice right now, would they come in and think that this practice is not complying with the orders? Would they perhaps shut us down? Is that a possibility? So, well, the dental board is not going to be the enforcement agency. I would think in the future, OSHA would become involved, and that the employer is allowing people to be placed at risk. But the public health department enforcement, to me, it seems I would hate for my practice to be closed down on a public health order due to health issues. That would be like a restaurant being closed down because they found the cockroaches in the kitchen or unsanitary conditions. So that would certainly be harmful reputationally.
Leslie, I have to chuckle with that because in many states, the restaurants have to post their grade from the health department, and they've got their grade. If you're new to the area and you don't know what restaurant to go to, I certainly look at what the ratings are. So thank you for sharing that. Mary, let's take a moment and chat about the new CDC masking requirements and guidelines that just changed recently as well. So what can you share with us on that, please?
Sure. As if we don't have enough confusion already about vaccinations, the CDC on July 27th issued a new mandate or an update to their mask guidelines. And essentially what they were saying is that everyone needs, vaccinated or unvaccinated, needs to mask up when they're indoors. And that is primarily due to the spread of the Delta variant of the SARS-CoV-2 virus and its much, much greater transmissibility than other variants of the virus. The viral loads are said to be 1,000 times greater in this Delta variant in people who are infected than they are in other variants. And so even someone who is vaccinated who has a breakthrough infection is now believed to be capable of spreading the COVID-19 virus, where in the past they were not believed to be able to spread. And we have a great example of this, which unfortunately the CDC didn't divulge when they first gave this mandate, this change to the public. When they announced it, they said the reason for masking up again indoors, vaccinated or not, was because of the increased transmissibility. But they didn't quote the science. They didn't share the information that led them to make the decision. And what led them to that decision, and we'll include this resource with this podcast, is a series of breakthrough infections that happened in July in Provincetown, Massachusetts. And it happened to be over the time of the 4th of July holiday. So lots of people there. If you've ever been to Provincetown, Mass, you know it's kind of a small town and the streets are narrow and you get a lot of holiday revelers there celebrating. It's a great super spreader place. And what they found in the 496 cases that were identified just in Massachusetts residents of COVID-19, at least 74% of them were people who were fully vaccinated. So that's the rationale behind this, which unfortunately the CDC didn't release at the same time that they released that mandate. So because we know that 90% of the cases now of COVID-19 are from the Delta variant, and we know that it's so much more transmissible, that's why. So when patients come into your practice, they need to be wearing a face mask. Actually, that never officially changed In the CDC guidance, it changed for public health settings, but many people mistakenly believed that if a patient was vaccinated and they were told that they didn't have to wear a mask indoors, according to CDC public guidelines, they didn't have to wear one in the office, but they still have to. So you may have to reaffirm to those patients. You may need to, if you stopped requiring masks for patients coming into your practice, you should let them know when you confirm their appointments, post something on social media, put it on your website, however you can let them know, so that you don't surprise them. But we never should have stopped, the same as we never should have stopped screening our patients, because the CDC did not change their guidance on that for anyone, vaccinated or unvaccinated, coming into the practice.
Phew, thank you, Mary. It's just keeping up with all the changes is it's very, very challenging for us right now. And so, yes, there's more information that's unfolding and about Delta, and that is pushing, if I could say, driving the changes that we're seeing now. And so our lives are just going to be a little bit bumpy as we sort this next place out, especially for our California listeners, and what to do next and how to manage that. But Mary, let's also talk about another change, if you don't mind, with the CDC guidelines. And they made a change recently about aerosol generating procedures. Can you just revisit that for our listeners too?
Absolutely. Yeah. One of the things, if you remember from one of the first sets of dental guidance that came out from the CDC, I believe back in April of 2020, the guidance said that aerosol generating procedures should be avoided whenever possible, which sort of isn't realistic for us in dentistry, and that the use of ultrasonic scalers was not recommended. And then slowly this guidance has evolved over the last year or so. And the most recent change that we have to the guidance that happened at the end of July now says that if aerosol generating procedures are necessary for dental care, use four-handed dentistry, high evacuation suction or HVE, and dental dams to minimize droplet spatter and aerosols. The number of dental health care personnel present during the procedure should be limited to only those essential for patient care and procedure support. So they no longer say that you couldn't or shouldn't use an ultrasonic scaler. They no longer say that you shouldn't do aerosol generating procedures, although the CDC does continue to say in the guidance that if you need to do an aerosol generating procedure on a patient with a known COVID infection, then that should be done in a facility where there is negative air pressure available so that that virus can't be spread. So the bottom line is that OSHA also, or the CDC and OSHA also say that if you're doing aerosol generating procedures, you should be wearing appropriate respiratory protection, which is an N95 respirator.
I'll second that. Yes, exactly, Mary. The N95 respirator, those changes that requirement has never gone away. And I think that all of the Divas feel that we expect that to be long-term, if not the normal for us going forward in the future. Olivia, when we think about the transmissibility in the community, CDC has given us some guidance on how to look at that information and how to evaluate it. Do you have any thoughts or comments on that regard?
Yes, thank you. We look at CDC's guidance on the use of PPE, and there is a difference. So they suggest that if there's no to minimal community transmission and if COVID is not suspected, standard precautions. However, CDC advises that in communities where there is moderate to substantial community transmission, that during aerosol generating procedures, as Mary pointed out, we should wear an N95 respirator or equivalent, or higher level of protection, such as disposable filtering face piece respirators, PAPRs, or elastomeric respirators. So that brings us back to the guidance of checking the COVID tracker on CDC's website. And we understand at the present time right now, so many of our communities are either in substantial or high risk categories. So they need to choose the appropriate PPE in order to be in compliance with OSHA, because OSHA is going to refer back to CDC's guidance.
Yes, absolutely. OSHA does refer back quite a bit. And so I'd like to also mention, when you talk about the CDC tracker, Olivia, that to our listeners, that we will make that link available on our website after the podcast. And if someone wants to search it on their own, I simply use the term CDC COVID data tracker, and you'll come up with a URL that will take you right to that site. And this morning I was looking at the some of the statistics in Florida and found the website very easy to use. So that's one of the tips I would share. Leslie, what tips can you share with our California dental listeners, please?
Well, I'd like to leave everybody with some of the frequently asked questions that I've been getting lately, because I think that 80% of the questions that are coming in are the ones that most everybody has. And I want to just quickly follow up on Olivia's statement regarding OSHA and the recommended PPE. I want to remind everyone that the word recommended, don't let that word fool you. There have been citations that have been issued on not standards, but on the guidelines or the recommendations. So we need to also be very careful. Don't lose sight of your N95 and everything that is required in order to wear an N95. We have California is offering voluntary use of an N95 respirator, where any business, whether you're a grocery store or a restaurant, any employee who has nothing to do with healthcare can request an N95 respirator under voluntary use from the employer, and the employer has to provide it. For healthcare settings, the employer has to pay close attention to the hazard present in the dental practice, as Olivia mentioned, a hazard assessment. And if there's a chance that an employee could be exposed to a hazard, such as SARS-CoV-2, during an aerosol generating procedure in an area where there's a high transmission in the community, which is everywhere right now, then an N95 respirator would be required. And I want to remind our listeners that that includes fit testing, including annual fit testing. If you did it last year, you're probably due to do it again, and also medical evaluation. We have a resource for fit testing. The Compliance Divas have taken the time to put together a video along with checklists and some forms that help anyone on the dental team conduct that fit testing. It doesn't matter if you are the dentist, the hygienist, the dental assistant, the office manager. Anyone can watch the video, learn what they need to learn about the requirements surrounding the use of N95 respirators, and be well protected. Now, on the frequently asked questions, what I've been hearing lately is, does this mandate in California apply to all dental staff, including people at the front desk? And the answer is yes, it includes everyone, unless someone at the front desk has no contact with anyone else. Perhaps you have someone that is an office administrator that has their own office, and they go in that office, they close the door, they have no contact with patients or with other employees. Also, are owner dentists required to comply with this mandate? Absolutely. They are considered part of the healthcare team, and they have to have either proof of vaccination or be tested, just like the employees of the practice. And also, the date to begin, the order is effective as of Monday, August 9th, and dental practices have to be in full compliance by August 23rd. There is also an important aspect of those who don't get vaccinated, how those test results are stored. They do need to be stored and managed in a confidential manner, just like any other employee medical records would be stored. And we want to make sure that that those records are not accessed by others. I know that there's a highly charged environment surrounding vaccinated versus unvaccinated individuals. So really, the person who is eyes on that employee record, I would just recommend that that be the dentist employer, rather than making that vaccination testing information available to everyone else. The other thing is, as mentioned earlier, Olivia said that a dental practice can make COVID-19 vaccination a condition of employment. In California, we can make that. Yes, it can be a condition of employment. And then finally, the last most frequently asked question that's coming across my desk is, who pays for the testing and what kind of testing has to be done? Can it be a rapid test? So we still aren't sure exactly whether employees will need to bear the burden and expense for the testing and the time away for the practice, or whether that's going to be something that is going to be something that the employer bears. And as I find out from state agencies and I get clarity on that, I'll be sure and provide that resource in this podcast resource section. Also, with regards to the test, which tests are going to qualify for weekly testing? Would it be point of care, rapid test, community testing? And do the sites need to be approved by FDA, or the tests need to be approved by FDA? And the answer is yes. So antigen and PCR tests do qualify and must be FDA approved. So I think that is the majority of the frequently asked questions that have come across my desk. And I know the compliance divas are looking for any type of questions surrounding this topic. We would love to get those questions and would be happy to provide answers to you.
Thank you, Leslie. There's so much content-rich information with this podcast. I would certainly encourage our California listeners to even listen to this podcast twice and be sure to share it with their team members. And you did a great recap of the deadlines, August 9th, August 23rd. And in the meantime, some of the tips that Olivia has shared with us on the HR side, dentists may want to talk to an attorney to get some advice about some of the legal issues with HR, so they can be sure they're staying in compliance and treating their team with fairness across the board, but with the idea of the most safety and concern for everybody, team members and patients alike. So thank you for joining us on this special edition of the Compliance Divas podcast, where we discuss California's late-breaking mandatory COVID vaccination order. We bring clarity and simplicity to compliance by navigating regulatory compliance to keep you on course. All the resources that we've mentioned during this podcast will be available on our Compliance Divas website, and we invite you to submit questions to support@thecompliancedivas.com. That is support@thecompliancedivas.com. Thank you for joining us.